Hello everyone. Today in this video I am going to tell you some interesting facts about mask. So let's move into the topic. This mask is a personal protective equipment used by the healthcare professionals during the medical procedures. Nurses, doctors, technicians, when they are dealing with the patients in collecting the samples, or when they are doing some surgeries, and when they are providing some medicines to the patients. Okay, so there are chances the patient can cough, or the patient can sneeze, and during some medical procedures, when the doctor is performing some operations and all, the pus or the blood, it can spill over their body and over their face. Okay, to protect themselves from this type of accidents, the healthcare professionals will be using this mask as a protective equipment. It prevents the transmission of airborne infections, because germs which are capable to cause the diseases will be moving in this air. So to protect themselves from such type of infections, these healthcare professionals will be using this mask. What this mask will do actually? This mask will block the movement of pathogens from inside and from outside. It means if you are wearing the mask, you will get protected from the pathogens which are present inside the air. And if you are wearing the mask, and if you are suffering with some disease, and if you are wearing the mask, so whenever you are coughing, or whenever you are sneezing, what happens, the microorganisms or the germs which are capable to cause the disease will come outside from your body, but they cannot enter into the external environment, because this mask will block the microorganisms from the inside, and it prevents the entry of microorganisms into external environment. Okay, so it blocks the movement of pathogens inside and from outside. Organisms which are outside cannot enter into the body, and organisms which are coming out from the body cannot enter into the environment. So this is about the introduction about mask, and let's see the history of mask. Mask is firstly developed by the European physicians, and to increase the awareness of germ theory and antiseptic procedures inside the medicine. To increase the awareness of this germ theory and antiseptic procedures of the medicine, these European physicians have invented the mask. Then later, Dr. Wu Lin Thi, he developed the mask by adding some cotton and gauze, so that it can filter the microorganisms or the germs, and it will allow the air to breathe. So he is the person who developed the mask by adding some cotton and gauze. Actually, he is the physician. He is a China Malaysian epidemiologist. He used to perform autopsy. One day, while performing the autopsy, he asked his fellow doctor to wear the mask. His name is Gerald Mesny. But Gerald Mesny has refused to wear the mask. At that time, there was a dangerous disease that is called plague. So when Dr. Wu Lin asked the Gerald Mesny to wear the mask, the Gerald Mesny has refused to wear the mask, and after few days, that Gerald Mesny has lost his life because of this plague. And what are the different types of masks available? So we have currently 3 types of masks. One is surgical mask, another one is N95 mask, and cloth mask, which is made up of cloth. So let's see what is surgical mask, and what is N95 mask, and what is cloth mask. You can see in the image here. So this is the surgical mask. Surgical mask is made up of 3 layers. So what are the 3 layers? In the image you can see that the 3 layers. This is the outermost layer, which is blue in color, and the middle layer you can see some white color paper like structure, and backside inside the 3rd layer, innermost layer, you can see some transparent layer. Okay, so this is the outermost layer. That means we are wearing this mask in the outside. Okay, outermost layer is the fluid repellent layer. So whenever somebody coughs, whenever somebody sneezes, a big droplets will come out from their nose or mouth and they will fall on our body. But when that such type of droplets will fall on this mask, this is a fluid repellent. That means it will not allow that fluid to enter inside. It will prevent that fluid, it will stop that fluid, it will not allow that fluid inside. So this layer is called as a fluid repellent layer. And after that fluid repellent layer, there is another layer, that is high efficiency filter. That means whenever we are breathing, so lot of organisms will try to enter into our body. So what this filter will do is it will stop all those microorganisms, and it will stop them, it will stop the entry of such type of microorganisms into our body. And the last one is the absorbent layer and innermost layer. If we are suffering with some disease, if we are suffering with some health problems, some respiratory problems, and when if we are coughing and sneezing continuously, then when you wear the mask, the droplets which are coming out from your body when you cough and sneeze will fall on this absorbent layer, and they will get absorbed and they will not enter into the society. As a result, spread of infection will be reduced. So absorbent layer will reduce the spread of infection from one person to many persons. And this outermost layer will protect you and will protect you when you are trying to treat the sick patients or patients. Okay. And next one, surgical mask. It is disposable and we cannot reuse it. It is a single time use, one time only we have to use it, and after that we have to discard it. It effectively blocks the droplets, splashes, sprays which contains the germs, but it cannot filter the organisms which are less than 1 micron in size. So that means it is clearly indicating that this surgical masks are having capability to filter only bacteria, not the viruses, because the size of the bacteria will be in the microns and the size of the viruses will be less than the microns. That means the size of the viruses will be in the nanometers. The size of the virus will be in the nanometers. So here it is here, from here we can clearly understand that surgical mask cannot stop the entry of virus into our body. So there is no use of using this surgical mask in this current pandemic situation. So the next mask, N95 mask. You can see here in this image, this N95 mask will fits to our face perfectly, and it will not allow any air from the outside. So that means whenever we are breathing, every ml of air we are breathing will pass through this mask and it will enter into our body. But whereas when we talk about this surgical mask, it cannot fits to the face perfectly. It is loosely tightened, and whenever we are breathing, the air from here and from here and from here also it can enter, or whenever we are coughing, sneezing, the air will get leaked in case of surgical mask. But whereas in this N95 mask, there is no chance of leakage and every ml of air will get filtered. So let's see how N95 mask is made. N95 mask contains 4 filters. The first one is the non-woven outer layer, second one is hydrophobic layer, third one is filtering layer, and fourth one again it is a hydrophilic layer. So here it is non-woven outer layer, it filters the largest particles, and hydrophobic layer, whenever there is a spillage of blood or body fluids or some droplets or splashes, it will block them, hydrophobic. And filtering layer, further isolation of the bacteria. If any bacteria after crossing this hydrophobic layer, if it enters into the mask, then that will get filtered here. And hydrophilic layer, it will absorb. If you are suffering with some respiratory tract infections or something, then when you cough and sneeze, if the bacteria or virus, when it is coming from your mouth, it will fall on this hydrophilic layer and it will get absorbed. And here it is mentioned that it will absorb the water, sweat and saliva from the patient. And this hydrophobic layer, it will absorb the things which are coming from the outside, and it will absorb the things which are coming from inside. So these are the 4 different types of layers present inside the N95 mask. And N95 mask can filter up to 0.3 microns, that means up to 300 nanometers. and some N95 masks are also having the capability to filter up to 0.07 microns, that means 70 nanometers. Okay, so that's why it is called as N95 mask. So N95 mask is having capability to filter the virus, because the size of the virus, current virus, that is coronavirus is having a size of 120 to 280 nanometers. So coronavirus cannot be filtered by the surgical mask, but N95 mask is having the ability to filter the coronavirus. And make sure that N95 mask should not have that respiratory cap like structure. If you are using a mask with that N95 with a respirator, then there are chances that virus can pass through that respirator. So please avoid using that N95 with that respirator cap like structures. Okay, so this is about N95 mask. And the last mask is the cloth mask. Everybody is using this cloth mask nowadays, because to buy it is very costly to buy a surgical mask and a N95 mask every day, because they are very costly and they are disposable. That means we have to use them only for a single time. So everybody nowadays buying this cloth mask, but actually the pore size of this cloth mask is very high. It cannot prevent any bacteria or any virus. It cannot stop the entry of such deadly viruses, bacteria to enter into your body. So cloth mask is not having any ability to stop them, and it cannot give you any protection. Simply to save the money, people are using this cloth mask, but it is very risky to use this mask. But these masks can be washable, and if you dry in the sun, people are telling that it is very good. If you dry in the sun and if you wash it properly, then you can use this mask. But these masks are not going to provide you a proper protection for you from this deadly diseases like corona. And as per WHO, World Health Organization, the top organization in this health medical field, it will guide us what to do and what not to do. As per this World Health Organization, it is guided that cloth masks should not be used at any circumstance. And at any circumstances, here I am providing the link also here. I will upload the same link in the description of this video, so you can read the link and you can find out there. The last point they have mentioned, World Health Organization, cloth mask should not be used. You have to use only surgical mask or N95 mask. Use mask when we have to use the mask. When you are in the public places, use the mask. And if you are treating the sick patients at the hospital, or if some sick people are present at your home, then try to use the mask. Then when you are talking with the other people, use the mask. When you should not use the mask, if you are healthy, no need to wear the mask. And if you are alone, then no need to wear. If you are alone in the home, if you are healthy and if your all members of the family are also healthy, then no need to wear the mask. And if you are traveling alone in the car, no need to wear the mask. And if you are attending some online classes or some office meetings from home, then no need to wear the mask. And to be safe, avoid crowded places and closed areas. Cover your nose and mouth with the flexed elbow during the when you are coughing and sneezing, like this. When you are feeling that sensation, coughing and sneezing, cover your nose with the flexed elbow like this. But some people will try to close their to stop sneezing and coughing. They will try to close the mouth and they will try to close the nose, but this is a dangerous procedure. There are many cases where people try to stop this sneezing and coughing by closing their nose and mouth, and it leads to death also. In there are many situations where it led to death. Okay, why? Because whenever you are sneezing, the air from your lungs will come out at a high speed, 100 miles per hour. If you try to stop that air by blocking the nose, the air will find some other way to get to exit from your body. So at that time it can pass through your it can break your eardrums, or it can damage your nasopharynx, and it will damage to the it can cause damage to the epithelial cells, and finally it can lead to death also. So never try to stop the sneezing mechanism or coughing mechanism. Please try to use your flexed elbow when you're coughing and sneezing. So last one, this is also from the WHO only. However, the use of mask alone is insufficient to provide the adequate level of protection. If you are using the mask, then don't think that you will not get any respiratory diseases or any diseases. Using mask alone will not provide you the complete healthiness. At the same time, you should also follow the hand hygiene, and maximum try to maintain not to touch your face with your bare hands. Okay, thank you.